This is Ellen Clark, CEO and founder of Control Corrective Skincare Systems. This is a demonstration of our 7-day skin rejuvenation treatment, incorporating the Jessner chemical peel. This highly specialized progressive Jessner epidermal peel helps reverse signs of aging, treat resistant impacted acne, and lighten hyperpigmentation. For a day or two after application, the face looks slightly sunburned and does not peel. After that, however, the depth and intensity of this treatment requires several days of downtime as the skin flakes away to emerge totally renewed. During recovery, lines, wrinkles, scars, dullness, hyperpigmentation, blackheads, whiteheads, and ingrown hairs all appear to peel off and away. A hydrating post-treatment done a week later fortifies newly refined and luminous skin with concentrated moisture. We've just cleansed our client's skin with the gentle facial wash and the soothing chamomile eye makeup remover. Now I'm going to use the Exfo Tonic to degrease her skin. You can use the Exfo Tonic or the balancing tonic depending on the skin type. If the client is oilier and less sensitive, you definitely want to use the Exfo Tonic. It's going to degrease more, remove more of the oil on her skin. Sometimes, because there is some alcohol in here, the client may get a little pink or they may not like the smell, so you can turn the fan on early. And you want to make sure that your tonic is totally dry before you put your Jessner solution on. What I'm going to do is I'm going to have the client hold the fan comfortably, or you can clip the fan on, but they definitely are going to need the fan because as we layer the Jessner peel, it has to dry, and it takes anywhere from 5 to 10 minutes per coat to dry. So I am just going to have my client hold the fan just because we're doing the video right now, just on the first coat, and then I will hold it. I like to use these 6-inch cotton tip applicators, and I scotch tape 2 together. When you do the Jessner, some people use a little 2x2 gauze, but I find that as you layer, you're going to need something else because it thickens. But these are perfect. They're not too, Q-tip sometimes gets too loose at the tip. This is a perfect applicator. I find also fan brushes don't work real well because you have the possibility of dripping. So the Jessner chemical peel solution is a watery solution, so you want to make sure that the client is semi-reclined. And you never hold the jar or the bowl over her face, so always make sure you keep it to the side. And we're going to be applying our first coat. And you go in little circular motions around the entire face. The client will feel a stinging, and generally after you get it on, let's say a large area like the forehead, you can ask the client how it's feeling before you go to another part of the face. Some clients will frost sooner than others. It really depends. And as I'm getting this full coat on her, I'm going to talk more about this process and this peel. So I put it on her forehead. Now I'm going to go to the side of her face. Again, because it can drip, it's easier if you just move the client's face to the side. I stay a good ½ inch away from the eye opening area because liquids can migrate, and I don't want anything to get into her eye. Plus, clients can sometimes tear during the process. So you can see, I'm just going, there's no rush. This product is not coming off her face. It's going to stay on and dry. I stay 1/8 of an inch from under the eye area. And if you do have all the instructions, the contraindications, we'll go over some of them, but it's in all the materials that you have. For example, you wouldn't do this on somebody pregnant or with herpes or recently having had any kind of chemical process. When in doubt, always have them check with their physician. I tend to avoid coming too close to the nasolabial fold area because it can get dry there and itchy, so I kind of stay out of that area. And you don't want a pooling or like a crater area to fill with the solution. So you just kind of take your time. You see I'm going over the same area, that's fine. She has some acne scarring right here, so I'm working it in. You want to use good firm pressure. Then I'm going to turn her head over this way. I've probably got about 1/4 of an ounce in here. Now this is a client that I had her prepare. She did the prep. I had her on our multi-complex fade gel to help lighten hyperpigmentation that she was experiencing, and she started that 4 weeks ago. She also started to use our Intensive Skin Lightening Day Cream SPF 30, again with more melanin suppressing activity. So we're already starting to lighten pigmentation. I had her also using our Smoothing Repair Gel, which is a glycolic and lactic gel. So we're resurfacing. The strategy is, if we can already start lightening hyperpigmentation, we can already start resurfacing at home. I'm going to need to use much less peel solution on her, and she's going to get a far better result. And she doesn't have a lot of wrinkling. She has more light pigmentation and some old acne scars. A little bit of signs of aging, but not bad. And she's really a perfect candidate for this peel. So what's going to happen is, now this has to dry. This has to dry, and I'll grab that from you. This has to dry on our skin for anywhere from 5 to 7 or 10 minutes. We want the whole first coat to dry. You want to check in with your client on the level of stinging on a scale of 1 to 10. How does it feel for you on a scale of 1 to 10?
5.
A 5. So I'm not going to put another coat of the Jessner solution on until she feels no more stinging. Usually what happens is, the first coat, the client feels stinging like about a 5 to 6, and this will only last for a few minutes. Then the stinging will go away, and the product will start to dry on her skin. And then I'm going to put a second coat, and that'll sit on her skin for anywhere from 10 to 12 minutes. As you layer the coats, it gets thicker, almost like a wet powdered sugar, so it takes longer for each coat to dry. So you put the first coat on, and then we're going to wait, then we're going to put a second coat on, and we're going to wait. And we're going to do this anywhere from 3 coats to 6 coats. You're going to leave it at 3 coats for people that are sensitive, people that are higher Fitzpatrick, olive complected, Mexican, African American, darker skin, because the risk of post-inflammatory hyperpigmentation is so great with those skin types that the strategy is to get them on really good home care melanin suppressors, and then use as little Jessner as you need to get that skin sloughing and turning over. The beauty of this treatment is it is an epidermal peel, so really we're just working in the top layers of the epidermal skin, and we're lifting it, almost like as a sunburn would do, but it's accelerated. Another nice thing about this is that after the second coat, the stinging goes away. So she might feel a heat and stinging on coat 1, same as coat 2. By the 3rd, 4th, 5th, 6th coat, what happens is they start to just feel tight, a little almost like numb. They don't feel as, they might feel warmth, but she doesn't feel the stinging. So it's very tolerable, and what is going to happen is she's going to leave here looking sunburned, kind of like you do after you've been skiing. And the next day, she's going to look a little more sunburned. So if you sunburn pink, you look more pink. If you sunburn brown, you get more brown. Then on day 3, 4, and 5, she's going to peel like a snake, usually around the mouth first, and then it goes out to the sides of the face. And as you're peeling, you can use a little cuticle scissor to cut that skin off. And by day 7 to 10, the skin, what emerges is this fresh baby skin that's toned, pores are tightened, and it's quite noticeable, particularly for pigmentation on lighter skin complexions. It's really important that you do a good skin analysis, that you do other treatments, lighter treatments on the client before you do a Jessner peel, and then you have her come back on that 7 to 10 days later for a post-facial. You're also going to give her product to go home with. So we have an Ultimate Repair skincare kit, and that has our growth factor, treatment cream, gentle cleansing, sunscreen. It's going to give her everything she needs to use at home, and you You typically will include that in the price of the service. Some people will do one peel a year. Some people will do one peel every quarter. Depends on the goals of the client. I've had clients that have acne scars and they really want to reduce them, and I'll have them come in every 6 weeks for a series of 3 or 4. So as you use this, you'll decide more how you want to deal with it. How's the stinging now?
It's decreasing.
Decreasing. I don't know if the camera will catch this, but there's some frosting here already on the first coat. There's frosting here because this client has really well exfoliated skin, and what the frosting is it's just the product oxidizing on the skin. At the end of the treatment, her whole face will look white, almost like white powdered sugar, and it'll dry it'll dry and become like translucent powder and disappear after a few hours. Most clients don't frost as much on the first coat. Usually they'll frost later, and some people frost an hour after the process is over. They get more white. Everyone's a little bit different. Again, a lot depends on how they care for their skin. Another thing you can do with this process is you don't have to do, as I said, you can do 3 to 6 coats, but you can do 1 coat. If you have somebody with just congested milia or blackheads, whiteheads, a lot of them, and you're doing your glycolics or your clarifying enzyme facial, and it's not lifting out some of that, then you may want to do a 1-coat Jessner, which I like to call a micro peeling, and then the client goes home. You would actually finish after 1 or 2 coats, let it totally dry, put sunscreen on, and send the client home with some good sunscreen and nourishing products, and they'll get what I call like micro peeling. It's kind of like a light TCA if you find that these ingredients work well. How's it feeling now?
Better.
Better? Is it still tingling a little bit? Okay. I can tell that the product is soaked in, so that's great. But again, I'm not going to put more on until she tells me that, you know, the stinging's pretty much gone.
Probably at a 2.
Okay. You can see she's getting a little bit pink. I recommend too you take before and after pictures. I'll just review with you all, I'm waiting to put the second coat on, that the post-care treatment for this is and we have it in our manual, she cannot get water on her face for the next 48 hours. We really want the peel solution to set. If she gets a little water on her face in 24, or if she needs to spritz because it's a very dry climate, that's fine after 24 hours. But if she can wait the 48, we find that people get much better peeling and more even peeling. So no water on her face. She has to avoid the sun, heat, or excessive dryness. No saunas, no heavy exercising where you're going to be sweating a lot. We write down for the client too, no picking their peeling skin. You know, people have a tendency to want to peel their skin, and we don't want her to peel her skin. So those are important post-care instructions. Of course she has to wear sunscreen, because if we are lifting the pigmentation and she doesn't, the sun will stimulate melanocyte activity and she'll get more pigmentation. So essentially what we're going to be doing over the next hour, if we do the full 6 coats, is we're going to layer, layer, layer till we get to, let's say, ultimately 6 coats. You can do this treatment on the décolleté and the upper back, but you can never do them all together at the same time. It's too much chemical in their body. As you may know, that this Jessner solution is a combination of salicylic acid, lactic acid, and resorcinol in a hydroalcohol base. So we really at 14%. So we don't want to overdo it by putting too much product on. And 8 coats doesn't make them peel more than 6 coats. So at about 6 coats, it's as much as you're going to get. That's why I say the strategy is to peel them, get them in early before this for regular exfoliation, and you sending them home with a good exfoliation so they peel really well. How's it feeling now?
Good.
Can I put another coat on? You
Yes.
okay? Okay. Do you want to hold the fan on, or okay? Okay. So sometimes you'll still have the fan on. I just turned it off for the video, but you can have the client holding the fan. And as you can see, I'm going to repeat the same thing. It's as easy as this. Wait 10 more minutes, repeat it. I recommend you have a piece of paper and a digital timer. The piece of paper is just to make sure that you remember how many coats you've put on. Also, when you apply the solution, go into the hairline a little bit, because that is going to make sure you have no line of demarcation. You want to make sure the client does not wax, that they don't do any electrolysis, they don't thread, they don't put Retin-A on, none of those things for at least 2 weeks. If somebody's prone to herpes, they need to get on their lips, they need to get a prescription for like Valtrex or Zovirax if they are really prone, because the heat of this will bring up some activity occasionally, and nothing's worse than a cold sore. You know, I've been doing this peel for over 15 years, and I've taught it nationally, and I've trained so many estheticians to do it, and they absolutely love it. And one of the things I love about this peel is its consistency. It's been around since 1906. Dr. Max Jessner was the one that invented it as kind of like a recipe. And it really, what I love about it as an esthetician is that I pretty much 99% of the time get the same result with everybody. Some people may peel sooner than others. Some people may not peel as much as somebody else. But overall, the clients are going to be peeling consistently day 3, 4, 5. So we're going to let this dry, and we're going to apply more coats. Her face will ultimately end up being very white and frosty. That white frosty look will last for somewhere between 2 and 4 hours. So when the client leaves, you want to make sure that they're aware of that. And again, it'll just dissipate. So you may want to let them know they need to plan on going home after the treatment. Make sure you book their post-care facial, which should be all included in the treatment price, and check on them day 3. Make sure that when they're peeling that they're okay and that they feel comfortable, because they are going to be really tight. Tomorrow she's going to feel super tight, and the next day she's going to feel so tight she's going to feel like she can't open her mouth tight. So it's a great idea to check on her. One of the other things that I highly recommend is before and after pictures. So people don't remember, let's say, the dark spots they have or the scarring after the treatment. So if you are going to do Jessner, be sure to take a before picture, and then when they come in for their post-treatment, take a post picture. So again, if I was going to do the décolleté area, I would not do the whole décolleté and the face at the same time. I would do the neck and the décolleté, or the neck and the face, but not both together. This is not for the body. And then when she's ready to go home, I will review with her post-care products, and she's good to go.